statutory definition of a prosperous Wales is a productive, innovative, low-carbon society which uses resources efficiently and proportionately, including acting on climate change, and which equips people with the right skills and education to enable them to access decent work. So pick out those factors there: productive, innovative, low-carbon, using resources efficiently and proportionately, acting on climate change, skills with access to decent jobs, not just any old jobs, and bring that back to some of those factors which link back to health inequality, and you can see that there are clear links there as well. So 29% of what makes a difference to health inequality is our living conditions. So are we living in areas of high air pollution, which, by the way, if you're poor or if you're black, you're more likely to be living in areas of high air pollution. What sort of access do you have to the natural environment and the benefits that that brings to your physical and your mental health, which, by the way, if you're poor or if you're black, you're less likely to have access to nature on your doorstep and so on. What's the quality of your housing? Again, if you're poor, you're more likely to live in poor quality housing, and that makes 29% of the difference in terms of health inequality. So what are we doing about that in Wales? I'm going to go through each one of these areas. Some really exciting news. So the big chunk there, 35%, really challenging for Wales. One, because of its history, demographics, and the long history of intergenerational poverty, and the fact that we don't control social security is not devolved. I've been advocating a universal basic income. I put this forward to the Welsh Government more than a year ago, and just at the end of last week, just a week after the election, the Welsh Government have said that they will have a trial of a UBI. The modelling that I've commissioned on that UBI suggests that a UBI could reduce child poverty by 64% and overall poverty by 50%. We don't have any solutions which are working at the moment, and I think it's worth a trial, not just to look at it through the lens of does a UBI help to get people back into work, but what are the wider well-being benefits of a UBI? What could a UBI do when we start thinking about the long term, as is our statutory duty in Wales, and what's happening in terms of the changing nature of work, the increasing numbers in the gig economy, and that kind of precarious nature of employment. If we think then about living conditions, so those issues around housing, so we're seeing mass investment in housing retrofit, and again, I'll be setting out shortly some innovative ways to finance that retrofit challenge. We've also seen significant shifts in terms of how we look at mobility and transportation within our communities. So one of the early interventions that I made around the Future Generations Act was government plans, and this comes back squarely to this concept of wellbeing budgeting. The Welsh Government had plans to spend the entire of their borrowing capacity on building a 13-mile stretch of road because of its economic benefits. Now, when you start applying a wellbeing economics lens to that, and when you have an independent commissioner who's going to ask you questions like, please explain to me how that £1.4 billion is going to meet that goal of a prosperous Wales, which doesn't talk about GVA being the be-all and end-all of everything. Please explain to me how it's going to contribute to the goal of a healthier Wales, when actually what we need to do is to get people travelling actively on public transport rather than sitting in their cars in congestion, adding to the obesity crisis that we already have. Please explain to me how this meets the goal of a more equal Wales, when 25% of the lowest income families in that region don't even have access to a car. So you'd be spending that money to no benefit to them whatsoever. Please explain to me how this meets our goal of a Wales of cohesive communities, when what we want is communities interacting, travelling, talking locally, and so on. So when you put that to the government, its own legislation is completely at odds, and the government took a completely different decision and moved away from those long-term plans. They're now investing £800 million on creating 6 new train stations, massive investment in active travel and public transport in the region, because that gives you a better return on your investment in terms of those broader concepts of well-being. Briefly then around, and we have a whole new transport strategy which is very much focused around that. Briefly then, because I know we're running out of time, social and human capital, the sense of your relationships. Do you have people you can turn to in your hour of need? What is your sense of agency in your community? 19% of what makes the difference in terms of that health inequality gap. So we've seen during the pandemic that because of austerity and the approach of public services, quite simply, the services were not available in many of the communities to meet the needs that existed in terms of tackling loneliness and isolation, doing shopping, all of those kind of fairly basic things. And really interestingly, in Wales, linked to the Future Generations Act, we do once every 2 years national wellbeing survey, which is linked back to our national indicators related to our national wellbeing goals. And 2 years ago, when people were asked, is there a sense of community in your area? 52% of people thought that there was. The last national survey was done in September last year, and that had increased to 74%. And that is largely by public services working, because they have to work or had to work far more closely with communities, doing some really small things like how can we give some really small grants to the community activists who were delivering the leaflets about helping with shopping and helping with other things for people in the community, and really working in that sort of partnership approach with local organisations. And so if we think of that jump of 22% and link that back to the sense of community and the sense of agency in your community being so important to health inequality, we can see where there's a kind of real opportunity for, I don't like the term building back better because I think we need to fundamentally reconstruct, but certainly it's something that we can bring forward into new ways of doing. And then finally, employment and working conditions, this issue around decent work being absolutely crucial, 7% of what makes a difference there. So we're seeing in Wales now a Social Partnership Act, which will place new duties or enhance the duties from the Future Generations Act on the public sector in particular around decent work and how they secure that decent work through things like procurement and so on. So I could tell you lots more about some of the kind of more local examples of how this is is happening on the ground, from the intergenerational project, which sees children and older people coming together, and a 50% reduction in the use of antipsychotic medication in the older people's homes since those young people and older people have come together, and improved attendance in schools. Some of this is not rocket science. It's back to, what the things that make life worthwhile, what are those softer things. And I think we've spent far too much time focusing on GVA and this insatiable quest for growth, which is no longer growth, in my view, it's a malignancy. And actually what we need to be doing now is focusing on those things that make life